I'm Mohammed Moin, and today we're going to talk about a condition of the eye in which you get occlusion of the pupil. And here you can see there is a whitish membrane over in the pupil, and the iris is actually stuck to the lens over here, which seems to be cataractus, or this patient actually has had previous surgery. So this was actually not a cataract, and this was referred with a previous history of surgery or after trauma, and this patient had a limbal incision on the nasal, on the temporal side, and on the nasal side a side port incision. So what do you actually see in patients with the occluso pupillae? If so, this is the eye, and this is the iris over here, and this is the superior inferior iris, and if this is the lens. So if the lens is like this and there's a membrane which is formed in the pupillary area, that is going to be called an area which is occluding the pupil. This is called occluso pupillae. But then you would say, if somebody's got occlusion of the pupil, why is the iris not bowing forward? It should bow forward in this case. But in this case, we are not seeing a bowed forward iris, because if you say this is the lens and going behind, you've got the ciliary body at the back over here, and this is the pars plicata where the aqueous is being produced. With trauma, you can get shutdown of this ciliary processes, or because of severe uveitis, you can get formation of thick cyclitic membrane, which causes the aqueous production to reduce, and that produces that area of hypotony or low aqueous production. So if you go forward on the video, you're going to see that this is the patient, and the patient presented, the patient was no perception of light at this stage, and on B scan he had a detachment, which was a funnel detachment over there, and you can see there's a dense membrane, but the anterior chamber is formed. If there's iris bombae, then the anterior chamber would not be formed in this case. So it's very important to look at the depth of the anterior chamber, and actually in the center you would see that the depth of the iris is going or bowing backward in that area. But is the eye quiet, or is this an active disease at the moment? The conjunctiva is quiet. There is no ciliary congestion. So in these patients, if there is no area of ciliary congestion, then you probably will not do anything, except if the patient says that cosmetically the eye is phthysical, he does not want it to look like that. You can go in to do an evisceration or an enucleation, put an artificial eye later on after putting an implant. Here you can see the iris is actually bowing backward rather than coming. So it does have that bowing which you see, but or it could be an old bowing in which there was some iris bombae, but it's just gives you more look that something's going in a deeper pit rather than an iris bombae which is coming into the angle in this patient. So it's very important to look at the slit, how it looks like, and what are you going to tell this patient, that the patient has got a very poor visual prognosis, and the patient can benefit cosmetically if he wants. But if it's not a painful blind eye, it would be preferable to leave it as such. So thank you very much for watching, and if you like the channel, please subscribe and click the like button. Thank you.